The dog noticed her before the man did. That was the first thing Maya Caldwell thought when she walked into room 14 of the Hargrove Veterans Care Center on a Tuesday night that smelled like antiseptic and old coffee. The shepherd, massive, dark-faced, with a chest like a barrel, lifted his head off the floor and watched her the way a sentry watches a gate, not aggressive, not welcoming, just watching, calculating, deciding. The man in the bed didn't look up at all. His name on the intake chart was Daniel Mercer. Former fire department, retired after 15 years. The admission notes were brief in the way that always meant someone had stopped trying to explain. Patient presents with acute depressive episode, social withdrawal, limited verbal engagement. Family reports increasing isolation over 14 months. Service animal on premises, see attached waiver. Maya had read those notes 3 times in the break room before coming in, and she still felt like she was missing something. 15 years fighting fires, a dog that watched strangers like a soldier, 14 months of disappearing from the world. She stood in the doorway and let the dog finish its assessment. He was a Belgian Malinois, maybe 8 years old, with a gray muzzle that hadn't been there when he was young. His vest was dark blue with a patch that read "Reddard K9, please do not pet." He sat with his back against the far wall, positioned so he could see both the door and the man in the bed at the same time. Maya had been a nurse for 6 years, and she had never once seen a dog choose that particular angle on purpose. "Mr. Mercer," she said, keeping her voice level. "I'm Maya. I'll be your nurse tonight." Nothing. He was staring at the window, which looked out onto a concrete retaining wall, lit by a security lamp. There was nothing to see there. He was staring anyway. She moved to the IV stand, checked the line, noted the saline drip rate. Normal. She checked his blood pressure cuff, pressed the button, waited. His arm didn't tense, he didn't flinch. He sat with the particular stillness of someone who had learned to remove themselves from a room without actually leaving it. The dog watched her the entire time. "What's his name?" she asked. She wasn't sure why she asked it. It wasn't on the chart. A pause. Then, so quietly she almost missed it. "Cinder." She looked at the dog. "Cinder," she said, and the dog's ears shifted, not turning toward her, just registering. That's a good name for a fire dog. Daniel Mercer said nothing to that, but something in his jaw changed, some small adjustment she couldn't have named if she'd tried. Maya finished her checks, recorded her notes on the tablet, and left without saying anything else. In the hallway, she stood for a moment with her back against the wall and let out a slow breath. She had been at Hargrove for 3 months. Before that, she'd been at Memorial downtown. Before that, a travel nursing contract in Wyoming. Before that, her first job out of school at a community hospital in rural Tennessee, where she'd learned that the textbook version of patient care and the actual version had very little to do with each other. She'd learned to read silences. She'd learned that some patients talked with their bodies long before they talked with their mouths. She'd learned that a man staring at a blank wall wasn't necessarily absent. Sometimes he was more present than anyone in the room, present with something that had happened years ago and hadn't finished happening yet. She'd also learned, in that first job, what PTSD actually looked like outside of a training module. Her uncle had come back from Desert Storm and spent the next decade sitting in a lazy-boy with the television always on, never watching it, just needing the noise. Her aunt used to say he was fine. Maya, even at 19, had known that was not what fine looked like. She pulled out her tablet and added a note to Daniel Mercer's file. "Patient minimally verbal, appears stable, service animal calm and non-disruptive. Will continue to monitor." Then she added, below the official notation in the comment field where she wrote things for herself, "He answered when I said the dog's name. Remember that." The second night, she brought him a cup of tea she wasn't supposed to bring him. The facility had a policy. All beverages through dietary, no outside food or drink, liability reasons, the usual. Maya had worked at enough places to know which policies existed for real reasons and which existed because someone had once written them down and no one had bothered to remove them. This one, in her assessment, fell into the second category. She made him a cup of chamomile from the nurse's station stash that technically belonged to everyone and brought it in at 11:15 when the floor was quiet. She set it on his tray table. Said nothing. Cinder raised his head, looked at the cup, looked at Maya, laid his head back down. Daniel Mercer looked at the cup for a long moment, then he picked it up. Maya stood by the window and wrote in her tablet and said nothing for the better part of 10 minutes. She was documenting her other patients' overnight checks, which she could have done at the nurse's station, but she found she preferred doing it here in the particular quiet of room 14. He was a search and rescue dog, Daniel said. She kept her eyes on her tablet, didn't react. Cinder before. When I was active, we did 4 years together on the mountain rescue team up in Asheville before I transferred down here. A pause. He retired the same year I did. How'd you know it was time? Another pause, longer. His hips started going. He'd come back from a training run, and you could see it cost him more than it used to. I took him to the vet, and she said another season might do permanent damage. He looked at the dog for a moment. I put in my papers the same week. Maya did look up at that. She couldn't help it. He wasn't looking at her. He was looking at Cinder, who had picked up on the sound of his own history and was watching Daniel with the focused, soft attention of a dog who had spent years learning to read one specific person. He didn't ask to retire, Daniel said. I made that call for him. She understood then that they were not talking exclusively about the dog. She finished her notes and left. In the hallway, she added to the comment field, disclose background, K9 Connection Central, do not separate. She found out about the meeting by accident. It was the third night, and she was coming off a double, 12 hours into what should have been her turnaround. When she passed the small conference room near the nursing supervisor's office and heard the words service animal and liability in the same sentence, she slowed down. She should have kept walking. She had always been bad at keeping walking. The door was half open. Inside were 3 people: Dr. Ellison, who ran the behavioral health unit, Sandra Pruett, the facility administrator, and a man Maya didn't recognize in a shirt that was too nice for the building. He had a lanyard she couldn't quite read from the doorway. The waiver covers the animal's presence during the admission period, Dr. Ellison was saying, but it doesn't cover the disruption to unit protocol. Other patients have complained. Which patients? Maya asked. All 3 looked at the door. She hadn't meant to say it out loud, but she had, and she was standing in the doorway now, and there was nothing to do but stay there. Caldwell, Sandra said, in the tone she used to end conversations. This isn't your meeting. I have Mr. Mercer on my rotation. I'd like to understand what's being discussed. Doctor. Ellison looked at her the way doctors sometimes looked at nurses who spoke in meetings. Not hostile, exactly, just recalibrating. We're reviewing whether the service animal arrangement is appropriate for this unit given the length of stay and the particular nature of the animal. The particular nature, Maya repeated. He's a retired working dog, not a standard emotional support animal. The behavioral profile is different. He's been documented showing what could be interpreted as guarding behavior. He's been documented sitting quietly against the wall of one room, Maya said. I've been in that room. I've seen guarding behavior. That's not what that is. You've been in that room, the man with the lanyard said. He had an even voice, the kind of voice that was trained to sound reasonable. How many times? Every night this week. And you feel qualified to assess the behavioral profile of a former K9 unit animal based on that observation. She looked at his lanyard. It said, Hargrove Health System, Risk Management. She understood then what kind of meeting this was. This was not a clinical conversation. This was someone building a paper trail. I feel qualified, she said, to note that Mr. Mercer has shown measurable improvement in verbal engagement over 3 nights, that his sleep chart shows longer uninterrupted rest than when he was admitted, and that the only variable that has changed is that Cinder has been allowed to remain. I'd think that would be relevant to any review. Sandra Pruett was watching her with an expression Maya had seen before on supervisors who were trying to decide whether an employee was an asset or a problem. She had been in that calculation before. She had never particularly enjoyed it. Thank you, Caldwell, Sandra said. You can return to your rotation. Maya returned to her rotation. She documented everything she had just said in her own notes, time-stamped, before she forgot a word of it. She didn't know what was decided in that meeting. No one told her, because she wasn't supposed to know about the meeting, and asking directly would only accelerate whatever timeline they were working on. She had learned this the hard way at Memorial downtown, where she'd pushed too hard too fast on a patient situation and ended up transferred to the night shift on the geriatric floor, not because anything she'd done was wrong, but because someone needed to be moved and she was inconvenient. She went back to room 14 on her next shift, and Cinder was still there, so for the moment, nothing had changed. Daniel was sitting in the chair by the window when she came in. That was new. He'd been in the bed every previous night. "You look different," she said. "I showered." A pause. "Cinder wouldn't stop staring at me. He does that when he thinks I'm letting myself go." She looked at the dog. Cinder looked back with an expression of complete neutrality that somehow confirmed everything. "Does he do that often? Hold you accountable?" "More than my ex-wife did." He said it without apparent bitterness, just as a fact of the record. She stopped looking at me after a while. "Cinder never has." Maya sat down in the chair on the other side of the small window, the one that was technically a visitor's chair, not a nursing chair, but the room was only so large, and there was nowhere else to be. She shouldn't be sitting. She had 4 other patients. She sat anyway. "You were with the department for 15 years, she said. 14 and a half, they round up. What did you do specifically before the mountain rescue team?" He was quiet for a moment. Then, structural, residential fires, industrial, some hazmat response. Then I got assigned to the mountain unit, and it was different kind of emergency. More time, more uncertainty. He paused. Structural fires, you go in, you get people out, or you don't. You come back. Mountain rescue, sometimes people are missing for days before you find them. Sometimes you don't find them. Sometimes you find what's left and you have to make decisions about what to bring back and what to leave. Maya said nothing. She had learned that silence at the right moment was the most useful thing a person could offer. "Cinder found a girl once," Daniel said, 8 years old. She'd been out there 4 nights. Hypothermic, dehydrated, 1 shoe off. Cinder found her and laid down next to her and wouldn't move until I caught up. She was breathing. A pause that stretched out. That was a good day. How many good days were there? He looked at her for the first time in the conversation. She held his gaze and didn't look away. "Enough," he said. "Enough to keep going. Until there weren't, what changed?" He turned back to the window. The last one. A man. 43 years old, gone off a trail in the Smokies after a storm took out the path markers. We had him on the 7th day. Cinder found him. He stopped. He didn't make it back. I made the wrong call on the extraction. Conditions on the ridge were worse than I read them, and I pushed the team when I should have waited. He was alive when we found him. He stopped again, for longer. He wasn't when we got him down. The room was very quiet. Somewhere down the hall, a monitor beeped its ordinary, unhurried rhythm. "That was 14 months ago," she said. 14 months and 9 days. She didn't say what there was nothing to say about, which was the thing that had happened to him in that time. She didn't say it wasn't your fault because she didn't know if it was or wasn't. And she knew, from her uncle, from everyone she'd ever known who carried something like this, that those words from the wrong person at the wrong moment could calcify a wound that might otherwise have stayed soft enough to heal. She said, "Cinder was there? Cinder's always there." She looked at the dog, who was watching Daniel with that same focused, soft attention. The dog who had found a living girl and laid down next to her in the cold. The dog who had been on that ridge. The dog who had watched 14 months of a man trying to disappear and had refused, quietly, insistently, to let him vanish entirely. "He's why you're still here," she said. Not a question. Daniel was quiet for a long time. "He needed feeding," he finally said, "every morning. Whether I felt like getting up or not." She found the notice in the morning. She had stayed late to finish charting. She was always staying late, a habit she'd never broken and probably never would, and she was at the nurse's station when she saw the printout sitting in the folder for room 14. It was on facility letterhead. It said, in the careful language of institutional decisions, that the service animal waiver for room 14 was under administrative review and that, pending the outcome of that review, the animal's presence in the clinical unit would be suspended effective Friday at 8 a.m. Friday was 2 days away. Maya read it twice, then she sat down. She thought about Daniel, who had showered because Cinder wouldn't stop staring at him. She thought about him 14 months ago on a ridge in bad weather, making a call that went wrong, coming down with a man who didn't make it and carrying that down with him ever since, retreating steadily from every room he was supposed to be in until there were no rooms left, and someone called his daughter, and his daughter called the number on the back of his insurance card, and here he was. She thought about Cinder, pressed against the wall of room 14, watching the door, watching Daniel, doing the only job he had left to do. She pulled up the facility's service animal policy on her workstation. She read it in full, which took 11 minutes. She then pulled up the ADA guidelines for service animals in healthcare settings. She read those too. She pulled up the VA caregiver support documentation, not because it directly applied, but because it cited 3 studies she wanted to cross-reference. By 6:15 in the morning, she had 4 pages of notes. She emailed Sandra Pruett and asked for a meeting. She emailed it to Dr. Ellison as a CC. She was professional and brief and used phrases like "I'd like to discuss the clinical basis for" and "consistent with facility protocol section 4.2", and she kept every word of what she was actually thinking out of the email entirely. Sandra Pruett responded 2 hours later, 3 p.m. today. Conference Room B. Conference Room B had a long table and chairs that were slightly too small for the table, which gave it the particular energy of a room that had been furnished by someone who'd ordered wrong and never corrected it. Maya arrived 4 minutes early and sat on the side of the table that faced the door. Sandra Pruett came in at 3 o'clock exactly, followed by Dr. Ellison, followed by the risk management man whose name, Maya now knew from his email signature, was Gregory Phelps. She had a folder. She set it on the table. "Thank you for meeting with me," she said. "Of course." Sandra Pruett had a way of sounding warm and immovable at the same time, which Maya suspected took years to develop. "We understand you have concerns about the Mercer situation." "I have clinical observations," Maya said. "I want to make sure they're part of the record before Friday." Gregory Phelps clicked his pen. "What record would that be?" "The record of the decision being made, which is a clinical decision as far as I can tell and should be supported by clinical evidence." She opened the folder. In the 5 nights since Mr. Mercer's admission, his sleep duration has increased by an average of 2 hours and 14 minutes. His verbal engagement scores, which I've been documenting during my nightly checks, have increased from a 2 on the first night to a 6. His appetite charting shows he's eating between 60 and 70% of each meal, up from less than 30% at admission. She looked up. These are measurable changes. The only significant variable is the continued presence of the service animal. Dr. Ellison was reading the sheet she'd slid across the table. "These observation notes are quite detailed for overnight checks. I document thoroughly. You've been spending extended time in his room. I've been conducting ongoing assessment of a complex patient." She kept her voice level. She had practiced keeping her voice level, which is within my scope of care. Gregory Phelps leaned forward slightly. "Ms. Caldwell, no one is questioning your dedication. What we're addressing is a facility-wide question of protocol consistency. If we make an exception for one service animal, it's not an exception," she said. "The ADA and the relevant VA guidance both establish that service animals in healthcare settings are not a courtesy, they're a protected accommodation. The facility's own policy, Section 4.2, Paragraph 3, specifies that service animal access cannot be revoked during a patient's active treatment period without documented clinical justification." She turned to page 3 of her folder. "I'd like to see the documented clinical justification for this review." Phelps looked at Sandra. Sandra looked at Dr. Ellison. Dr. Ellison said, slowly, "There were concerns about the animal's behavioral profile in a clinical unit. What specific behaviors? Reports from other patients. Which patients?" "There are 8 patients currently on this unit. 4 of them are in rooms that don't share a wall or hallway with room 14. I checked the unit map this morning." She paused. "Who reported a behavioral concern, and what specifically did they describe?" Another exchange of looks. The kind that meant no one wanted to be the one to say that the answer wasn't especially solid. "The concern," Sandra said, carefully, "was raised by a family member of another patient. They saw the dog in the hallway during a transfer and found it distressing. Found the dog distressing. Found the presence of a large working breed animal distressing. Yes." Maya looked at her folder. She looked at Sandra. She thought about the right thing to say, and then she said it. "With respect, that's the reason for the review? A family member was briefly distressed in a hallway?" She closed the folder. "If we remove that dog on Friday, Mr. Mercer will lose the primary stabilizing factor in his recovery. The clinical trajectory I've documented will reverse. He will very likely deteriorate. That deterioration will extend his stay, increase his care complexity, and significantly increase liability risk for this facility. She looked at Gregory Phelps specifically. I would think that's relevant to any risk assessment. Phelps had stopped clicking his pen. The room was quiet for a moment. Outside in the hallway, someone's sneakers squeaked past on the linoleum. Dr. Ellison said, "I'd like to see the full documentation." "I'll have it on your desk by 5, Maya said. Everything time-stamped and formatted for the chart. She didn't know what they decided that afternoon. She went home, slept 4 hours, and came back for her night shift. She was in the parking lot, still in her car, when her phone buzzed with an email from Sandra Pruett. After reviewing the clinical documentation provided, the administrative review of the service animal waiver for Room 14 has been suspended pending further assessment. The current accommodation will remain in place. Thank you for your thorough record keeping." Maya sat in her car for a moment with her phone in her hand. Then she went inside. She came into Room 14 at 11 that night, her usual time. Daniel was awake, sitting up in bed, which was also usual now. Cinder was in his usual spot, watching the door, and he tracked her from the doorway to the IV stand with his dark eyes in that way he'd developed, still wary, but the wariness had softened into something more like habit. She did her checks. She was quieter than usual, and he noticed. "You look like something happened," he said. "Just a long day." She recorded the blood pressure, made her note. "How'd you sleep?" "Better than I have in a while." A pause. "Cinder slept too. He doesn't always." She looked at the dog. Cinder looked back. She thought about a ridge in the Smokies in bad weather, and a girl in one shoe, and a man who needed feeding every morning. "I want to tell you something," she said, "and I don't want you to read more into it than I mean." He waited. "There are people in this building who wanted to change your arrangement here." With Cinder, she kept her voice even. "That's not going to happen right now. But I want you to know that it was a real conversation, and I want you to know that you have rights in that conversation that are yours to use. If anyone approaches you about changing the arrangement, you ask for it in writing, and you call your daughter before you agree to anything." He was looking at her steadily. "Why are you telling me this?" "Because you deserve to know what's happening in your own situation," she said. "And because nobody told you before, and that was wrong." He was quiet for a long time. Cinder had gotten up from his spot by the wall, something he hadn't done in her presence before, and padded quietly across the room. He stopped at the foot of the bed. He looked at Maya. Then he sat down with the deliberateness of a dog who had made a decision. Daniel watched this. Something moved across his face, not a smile exactly, but the first cousin of one. "He doesn't do that with people he's still deciding about," he said. "Good to know where I stand," she said. "Rachel," he stopped. "Sorry. Maya. It's okay. Maya." He said it like he was practicing getting it right. "Thank you." She finished her chart note. She didn't say it was nothing because it wasn't nothing, and she didn't believe in saying things that weren't true. She said, "Get some sleep. Both of you." She told this story once, months later, to a colleague who was struggling with a situation of her own, a patient being pressured into a discharge she wasn't ready for, a supervisor who kept using the word protocol as though it were a wall and not a door. Maya said, "The first thing you have to understand is that the chart is not just paperwork. The chart is your voice in the room when you're not in the room. Write everything down. Timestamp everything. Make it impossible to pretend you didn't say what you said. The second thing you have to understand is that patients often don't know they have rights. They came into the building sick and frightened and signed forms they didn't fully read, and then they assume the building has all the power. Your job is to stand between that assumption and the truth. The third thing, and she said this more quietly, is that sometimes the bravest thing you do won't look brave. It'll look like staying late. It'll look like documentation. It'll look like showing up in a doorway when you hear the wrong words and not walking away when someone tells you to." Her colleague asked, "What happened to the patient?" Daniel Mercer was discharged 8 weeks later. He left with Cinder. He was enrolled in an outpatient program that included both trauma therapy and a specific provision for service animal integration that had not previously existed in that program and was written in part because Maya had sent 3 emails and attached 4 studies to each of them. He sent a card to the nurses' station at Christmas. It had a picture of Cinder on the front, sitting in what looked like a yard with actual grass, gray muzzle tipped up toward the sky, ears forward, alert, watching something beyond the edge of the frame. On the inside, in handwriting that was careful and slightly uneven, it said, "Still here. He still needed feeding this morning. So did I." DM Maya put it on the corkboard above her locker and left it there through 3 more winters.